Welcome to this webinar, Introduction to Risk Assessment. As Yasmin said, I'm the Director of HR at the Chamber of Commerce, but to also make you aware, I'm an accredited IOSH trainer, the Institute of Occupational Safety and Health. So I've been training in health and safety, including risk assessment, for many years. And today I have just an hour to actually take you through some of the basics of risk assessment. So I'm just going to share my screen because I'm going to go through a presentation with you. So hopefully this will work, but I've got Yasmin on site if it doesn't, but hopefully that has worked. You can all see the presentation. So just as a way of introduction then, I'm guessing that you're on this webinar because of the recent government guidance regarding our return to work, which we're told is to be very much health-led, health and safety-led. And as part of that approach, the government is actually saying that we must, as employers, must carry out a COVID-19 risk assessment. Now, this is actually different to our normal workplace risk assessments. They're actually expecting a specific COVID-19 risk assessment. And for some, that's some people have been doing risk assessments for a long time, but for many, risk assessment will actually be quite new. So what I'm actually going to cover today is an introduction to risk assessment, just to give you the basics, so that at least you have some tools and techniques to go away with and be able to carry out the risk assessment that you need to do in your workplace. So I'm just going to move my slide on, which doesn't seem to be working. First technical problem of the day. Just bear with me. Now, would you believe this worked perfectly 5 minutes ago, didn't it, Yaz? Now I can't.
Yes.
I'm going to stop sharing my screen.
Yeah,
and
try
start
again.
Why isn't that moving on? Oh, we're there. Thank you for that. Got there. So I just wanted to talk to you a little bit about the legislation surrounding risk assessment. So what does the law say regarding risk assessment? Well, there's a lovely piece of legislation called the Management of Health and Safety at Work Regulations, which actually came into force in 1999. So risk assessment has actually been around for a very, very long time. And the legislation actually says that all employers must carry out a suitable and sufficient risk assessment. And for employers with 5 employees or over, then this risk assessment must be documented. Now, that doesn't mean to say that if you have less than 5 employees, you don't need to carry out a risk assessment. You absolutely do, but it just means that it doesn't have to be documented, which I always think is a little bit odd, because if you are carrying out a risk assessment, why wouldn't you document it? But the law says that only over 5 employees does the risk assessment have to be documented. And the recent new guidance in respect of COVID-19 is telling us that risk assessment is going to be fundamental to our return to work. And I'm told that there is an expectation that employers with over 50 employees would be expected to actually display the risk assessment on their website. So that's just something to be aware of. So just to talk to you about why risk assessments are needed, and it's actually quite simple. A risk assessment's needed because we need to identify the hazards and associated risks in the workplace, and we need to do this in order for us to know what we need to do, what we need to control to make the workplace safe, to keep people safe. And the risk assessment actually will talk about hazard and risk, and I do need to actually cover a few basic terms with you with regard to what we mean by hazard and risk. So hazard, definition of hazard, is anything that has the potential to cause harm. So as you can appreciate, we are actually surrounded by hazards all the time. Everything we do, there's a hazard involved in what we do. So the hazard is anything that has the potential to cause harm. And the definition of risk is how likely is it of someone being harmed by that hazard and how severe that harm could be. So there will be different definitions of risk. There will be hazards that will result in a low risk of someone being harmed or a high risk of someone being harmed. And when we look at risk, we look at if they were to be harmed, then how severe would that harm be? So relating hazard and risk to COVID-19, COVID-19 is actually considered high risk because the hazard, obviously the virus, the virus is the hazard. The risk is high that someone could contract that virus. It's very, very likely with what we know about COVID-19 that there's a very, very high likelihood that someone could contract the virus. And if they did contract the virus, as we know, unfortunately, the severity of the harm from that in contracting that virus would be high, because we know that potentially the outcome could be fatal. People do actually die from contracting COVID-19. And anything classed as high risk in the workplace has to be controlled. The law is very, very explicit on that. So we are actually going to be concentrating on one particular hazard in this presentation. As I said, it's a COVID-19 risk assessment, which I'm going to be talking to you about. It's very different to your normal workplace risk assessment, which will have a number of hazards contained in that assessment that you will have identified. But we're just looking at one particular hazard today. And in order to be able to manage a hazard, in order to be able to manage a risk, we do need to understand what we're dealing with regard to the hazard, and we need to understand how it can harm people. So what do we know about COVID-19 already? We're learning all the time, but already we know that it's spread through sneezing, coughing, talking and breathing. We know that it can transfer by hand from surfaces and will remain on surfaces for a period of time. This will be very dependent on relative temperature, humidity and surface type, so that we don't know for sure how long the virus is going to remain live on any particular surface, which is obviously something that we're going to have to be mindful of. And we know that it's primarily transmitted from people to others who are in close contact through respiratory droplets, by direct contact with infected persons, or by contact with contaminated objects and surfaces. We also know, unfortunately, that a potential consequence of the hazard could be severe. In fact, it could lead to death in many cases. We only have to look at the statistics to know that this is a real risk. We know that under the management of health and safety at work regulations, we cannot leave a high risk uncontrolled. We must control that hazard and risk in the workplace. And as I've previously said, we also know that as part of our return to work, we're required to carry out a COVID-19 risk assessment. Will be enforced by the Health and Safety Executive. We're waiting for details as to what type of enforcement that will be, how they will carry out that enforcement, but we know that there will be enforcement to check that employers are actually doing everything they can to make the workplace safe. Now, it's also important for me to tell you at this stage that we will never ever be able to reduce risk to zero. There's no such thing as a zero risk environment. We cannot get rid of the virus. We know that it's going to be around for a period of time, but we know that we cannot get to a zero risk environment, and the law recognises that. And the law actually tells us that we must control the risk as far as we reasonably can. So the phrase, as far as is reasonably practical, features a lot in all health and safety management legislation. And what we've got to try to do as employers going forward is do what we reasonably can to reduce the chances of people being harmed by this hazard. And You may or may not know this, but interestingly, there isn't a prescribed way to carry out a risk assessment. The law is very absolute in that it does require us to carry out risk assessments, but the law doesn't say, and you must carry it out in this way. There is no prescribed way of carrying out a specific risk assessment, and I have seen many, many types of risk assessments in the years that I've been working in health and safety. The important thing is that the risk assessment is carried out. But for the purpose of today's webinar, I just wanted to show you a couple of templates that you might want to use, or it would be useful for you to see what other organisations are using as their risk assessment template. And the first one I'm going to show you is the risk assessment template, which is available on the Health and Safety Exec website. The links obviously are on in this presentation, and Yaz will be sending out the presentation following this webinar. But if you go into the Health and Safety Exec website, this will take you to a recommended template that the Health and Safety Exec has issued. I'll come back to actually completing the risk assessment in a moment, but I just wanted you to actually look at a basic risk assessment template. If you've already got templates that you're already using in your own workplace, then that's fine. There's no requirement for you to use this template at all. But as I said, for the purpose of this webinar, I just wanted to introduce you to a couple of standard ones. I also want to show you the IOSH template that IOSH actually use in their Managing Safely course in the risk assessment module. Again, you'll see similarities there in terms of the template, but it is different to the Health and Safety Exec one. But that doesn't matter, it's fine. As long as the risk assessment is completed and with over 5 employees, it's documented, then that is absolutely fine. So, I'd just like to take you back to the Health and Safety Exec risk assessment template and just take you through, first of all, the headings and just give you a little bit of explanation around why the headings are there. We are going to be doing a little bit more work on this later in the presentation, where I'm actually going to complete a risk assessment form for you, but I just want to take you through the risk assessment template. So first of all, it's identifying what the hazard is. Well, in this particular case, we know that the hazard is COVID-19, so that's pretty straightforward. The next column is you need to consider who you're responsible for, who might be harmed by that hazard. Now, you may or may not know that as an employer, that we have a duty of care to anyone who is on our premises or anyone who's affected by our work activities. So when you're actually filling out your risk assessment template, you need to consider not just your employees, but what other category of person might come into contact with the hazard on your premises and who also might need to be protected. So that would be, for example, visitors, that would be members of the public, it could be contractors that you have come in to do some maintenance work. All those people have to be covered by your risk assessment and need to be documented on the form. So what are you already doing to control the risks? So this is your opportunity to actually think about things that you've already got in place. Now, I'm sure that prior to when we went into lockdown, we all started putting some things in place to protect ourselves against COVID-19. So, for example, you might have displayed some information of COVID-19 at your premises. That's actually a control measure because you're providing information to people, making them more aware of the symptoms so that they're able to take action. So this is something that you'd actually detail in the third column, what you're already doing. So you've got a record of the controls that you already have in place. But the next section, what further action do you need to take to control the risk? This is going to be the meaty part of the risk assessment going forward, because we know that we're going to have to do a lot of work to make our workplace safe in order to be able to return people to work. And this is where we need to think about what risks we're exposed to with regard to the COVID-19 virus and what we need to put in place to reduce that risk as far as we reasonably can. And as I said, I will give you some more information around this as we move through the presentation. The next column is who needs to carry out the action. Again, identifying the hazard and assessing the risk is only part of the story. You need to actually allocate actions to people on your risk assessment form and make sure that those people understand that they've been tasked with an action. Next column is quite self-explanatory. When is the action needed by? I'm sure many of you will, if you've not already, you'll want to start putting together a timetable for your return to work. So in order to support that, you need to make sure that actions you've identified as needing to be implemented have deadlines attached to them so that you know that the control is in place, ready for when people return to work. And then the final column, again, is self-explanatory. It's very important to make sure that when the action is being completed, that the action is signed off as being completed, because this will be your audit trail. This will actually be your evidence to show that you've risk assessed the COVID-19 hazards and risks, and you've put controls in place to make the workplace the safest place that it possibly can be. So it's very important to keep your risk assessment form fully documented and the actions signed off as being done. So as I said, I just wanted to give you a little bit of an example as to where how you can actually populate your risk assessment template. So as I said earlier, so we know that the hazard is COVID-19. The next column then is who might be harmed and how. So we know that we have a duty of care to all our employees. So obviously you would document that employees are a category of person that could be harmed by this hazard. And how could they be harmed? Because there's a risk they can contract the virus through infection. But as well as all your employees, as I've said earlier, it's anyone on the premises that's also a category of person that could be harmed by the virus. If someone comes into your premises to visit you or to do some maintenance work, they're going to be touching your equipment, they're going to be coming into contact with your employees. It's important that you recognise your duty of care, and these are documented on your risk assessment. What tends to get missed a lot of the time in risk assessment in this category, it's also anyone who is affected by your work activities. Now, these are people that may not necessarily be on your premises, but you might be the employer, for example, who will be sending out contractors to do work, carry out work on other people's premises. And you have a duty of care to protect the people who are coming into contact with those work activities. So if you have a number of people who are field workers or you're going out on site visits, your risk assessment must include the people that they are going to come into contact with, so that you risk assess the harm and what you need to do to protect that category of person. And also, when you're looking at who can be harmed and how, just think about that you may have employees or people that you come into contact with who might be particularly vulnerable, and you might have to put special arrangements in place or more enhanced arrangements in place for certain people that you are trying to protect. So this could be, for example, it might be a pregnant employee, again, will put into a particularly vulnerable category. It might be employees who have underlying health conditions, for example. So again, you might need to take more action to look after those employees. So it's very important for you to understand who your vulnerable employees are. So that's the first stage, understand who you're trying to protect here. So what are you already doing to control the risk? So I've already mentioned that you may have already put some controls in place prior to going on lockdown. So this is your opportunity to document those controls. We know that hygiene is a big factor when it comes to control of the virus. So you may want to put in this column that you actually have your premises cleaned regularly every day. to make sure that your hygiene is up to scratch and is at a level to protect against risk of infection. So that's the type of thing that you will put in this particular column. You might have already, for example, provided information on Covid-19 symptoms provided to your remote workers. So your remote workers aren't going to see the signage that's in your workplace, but you may have actually just to send that information out by another means, by email or verbally through staff meetings and that sort of thing. Anything you can think of that you're already doing, document on your form, because as I said, this will be your audit trail. However, as we know, unfortunately, the controls that we probably put in place prior to lockdown, now that we know more about the virus and how serious it is, are nowhere near enough to make the workplace safe for our return to the office and to our premises. So what further action do you need to take? And this is going to be the meaty part of your risk assessment. So for example, we wouldn't have done this before, but we now need to know that we have to implement 2-metre social distancing at our premises. And by positioning markers, people need to be aware of what the 2-metre distance is actually, because people have varying degrees of how far 2 metres is. So positioning markers in the workplace is something that you might want to do now that you didn't do before. You might want to introduce one-way systems, for example, so that reduces the risk of people coming to face-to-face with each other on their routes around the premises. It also makes sure that you're actually regulating the amount of people in the workplace at any one time, or in an area in the workplace at any one time. So again, something you might want to think about as an additional control. You might want to think about restricting the number of people in the communal areas that you have in the workplace and enforce that restriction. So this might, for example, if you have a lift in your workplace, restricting the number of people who could use that lift as any one time to say a maximum of 2, obviously depending on how big the lift is, whereas prior to lockdown, 8 people were allowed to populate the lift. Restrooms where people go to have lunch or just relax in their lunch break or in another break. Again, you might want to think about restricting the number of people in those areas so that you can enforce your social distancing. The number of people in the toilets, for example, you might want to implement a 1-in, 1-out system, so there's only one person in the restroom at any one time. You might also want to think about, obviously you'll be thinking about putting hand sanitizers in, making sure that you've got sufficient stocks of hand sanitizers. You might have brought some in prior to lockdown, but imagine on the return to work, we're going to be enforcing that so much more, and people will want to be using hand sanitizers all the time. An action you need to take now would be to ensure that you have got sufficient stocks in place at your premises in order to be able to manage that risk and provide people with that safety mechanism. And finally, and these are just examples, you know, the list will go on and on and on, and I'm just giving you an example here as to how you can actually populate a risk assessment template. An example here might be, I've talked to you about a category of person who might be particularly vulnerable. An action you might now need to take is to make sure you know who those vulnerable people are. You may think you know, but have you asked people recently? Encourage people to come to tell you if they feel particularly vulnerable and why, and make sure you know who those vulnerable employees are. The list will go on and on as you start looking through all the different hazards, all the different risks and the way the hazard can cause harm, and all the new things that you're going to have to do. You'll find that this is going to be a very, very long list. And because I've only got an hour today to take you through this this presentation, I'm just covering the very, very basics. But just to put it into perspective, I've recently completed the Chamber Risk Assessment, and I think I'm on page 11 now. I'm still writing. I'm going to be introducing it to our working party this afternoon, and we're going to have a lot of actions to implement as a result of our risk assessment. So this will be an absolutely key piece of work, which will actually mean you need to devote quite a bit of time to this before any return to work is even possible. So the next column, as I said earlier, you do need to make sure that you allocate these actions to people within your organisation. Now again, this will be down to you who you allocate actions to. So I've just put very generic roles here. So for example, I've allocated the action of implementing social distancing at the premises by positioning markers to our premises manager. It's useful to actually name people in a risk assessment rather than job title, because then it is very, very specific to that person that they have responsibility for carrying out that action. But for the purpose of this generic template, I've just put premises manager. I've also allocated the premises manager to introducing one-way systems. I've allocated responsibility for restricting the number of people in communal areas to departmental managers. Premises managers getting the action to make sure that we have sufficient stocks of hand sanitisers, and I've actually given HR the action to identify vulnerable employees. So it's very important to make sure that every action or every control that you decide to implement, that is actually given, someone is given responsibility for that action and it is implemented, and that new person is accountable. Obviously, the next column is when is the action needed by. You know, that's at your discretion. You know your plans for getting people back to work. You probably already have trains in mind. So obviously your actions need to be able to fit into that time frame. It's no good saying, right, we're planning to have people back at our workplace on the 15th of July, and then finding out on the 15th of July that actually an action hasn't been completed or something hasn't been implemented, because that means that you're not managing that risk, you're not controlling that risk, and it means that you've not made the workplace as safe as it can be. So it's very, very important to put timeframes in so that you know that the actions are going to be completed in time. And then, of course, the final column is your sign-off. So again, once the action's been completed and it's been implemented, you've got a record to show that it actually has been implemented in the workplace. I will give you a little bit more advice here around risk assessment before I move on to how we look at controlling risk. And risk assessment it should be a joint process. It should be a process that everyone works on together. It shouldn't be the responsibility of just one person without involvement and participation by people. It's a joint programme. And I will talk to you later on in the presentation about the requirement to consult on risk assessment. But in any event, even if the consultation wasn't a requirement of the Covid-19 risk assessment process, it's very important to make risk assessment a shared responsibility and a shared programme anyway. However, having said that, it's also very important to make sure that there is a person in your organisation who is driving the programme, who is leading on the risk assessment programme, who is making sure that the risk assessment is a suitable and sufficient risk assessment. It's making sure that actions have been allocated. It's making sure that those actions have been carried out by the person who's been tasked with that action, and it's making sure that the actions have been signed off. And this person who is responsible in the organisation for leading on the risk assessment programme really should be a person with authority and influence within the organisation. First of all, because obviously we want someone who is going to lead on the programme, and we want someone who actually has leadership and influence and skills. But we also need to think ahead. And again, this will be further down in the presentation when it comes to enforcement, monitoring and enforcement, because you might find that further line we have put control in place, but unfortunately they may not be followed. Hopefully they will be, but this is real life. And you will find, and I know this from experience, you will find that with all the controls you have in place, there may be people who bypass the controls and don't follow the controls. And then the organisation, as a responsible employer, obviously does have to take a stand and look at enforcing what action is taken as a result of that non-compliance. So it's very important that the person who leads on the risk assessment programme is someone with authority or influence within the organisation. So I just wanted to go on to risk control, because I've talked to you about risk control, and I've also said to you that actually this is going to be a big part of your work, is coming up with what you can do with controls to help make the workplace as safe as it possibly can be. There are lots and lots of things you can do to control a risk. So what is out there to help us? And there is something called the hierarchy of risk control, and I've got it on the screen now. This is the IOSH Covid-19 Risk Assessment Guidance. This is a diagram that they've issued on their website that you will get as part of this presentation, which helps us work through the risk controls that we need to be thinking about putting in place. So I just want to take a few minutes to talk about this hierarchy of risk control and why it's important. So top of the hierarchy, the most effective, the safest way to control a hazard is elimination. Can we eliminate the hazard completely? And in your normal workplace risk assessment, you may have found that it has been possible to eliminate some of the hazards. Unfortunately, when we're dealing with COVID-19, we cannot eliminate the virus. We wish we could, but we can't. So we can't even use the most effective way of risk control in this particular scenario. The next control on the hierarchy of risk control is substitution. Can we substitute the hazard with a less hazardous option? We can't. We can't say, right, we're not going to expose our people to the COVID-19 virus. We'll expose them to another hazard, another virus instead, which isn't as dangerous. So we'll replace the COVID-19 with a safer option. It's not possible to do that. So again, there's another control in the hierarchy, which unfortunately isn't available to us for this particular scenario. And you'll see now that we're coming down the hierarchy to the least effective options. So we're now into engineering controls. So these will be controls which I believe will feature a lot in our workplace going forward. So this is your ventilation, these are your physical barriers, for example. And I know that a lot of employers are starting to put perspex screens in place, for example, to stop that face-to-face contact between people. So that is classed as a physical barrier. So basically, it's an engineering control which has been put in place to stop people coming into contact with that hazard. It's preventing contact, it's isolating people where we can from that hazard, which is obviously going to protect their health and safety. Further down the hierarchy, and we are getting to the least effective options now, we're looking at administrative controls. And again, your admin controls are going to be controls which I think are going to feature very, very highly in the way that we're going to be able to manage this risk. So admin controls are basically all your processes and procedures, all your policies. They're your safe systems of work. They're written instructions, written rules as to how to behave in the workplace environment to protect yourselves. It's to adhere to the social distancing rules. It's to ensure that stick to the rules, where you only allow a certain number of people in a certain area at any one time. So your procedures, your policies, your safe systems of work, yeah, that will come under your admin controls. Signage is an admin control. Signage is going to be very, very prevalent, I think. Signage about the hazards and the risks associated with COVID-19, recognising signs of symptoms of contracting the virus, but it's also signage about what you can touch, what you can't touch, what needs to be cleaned each time after use. Again, an admin control, but very, very important that these controls are put in place. And the very last control on the hierarchy of risk control is surprisingly PPE. And we've heard about PPE over the last few weeks and months. PPE is considered to be the last line of defence when it comes to controlling a hazard, which may or may not surprise you. And the reason that PPE is notorious for being known as the last line of defence is that we're actually looking at human behaviour factor in managing risk here. And this is the same with your admin controls, actually, in that if you chose, if you could, elimination or substitution, you put your engineering controls in place, which is your physical barriers, you've taken the control away from the people being exposed to risk. If you're putting a barrier up, then they cannot get to the hazard. However, if you're controlling the hazard by implementing a process or a procedure or a safe system of work, or by issuing PPE, this means that you're very reliant on people actually following the rules, actually following the procedure, actually wearing their PPE, wearing it in the correct way, looking after their PPE. And this is why your admin and your PPE control is known as the least effective control in the hierarchy of risk control. It is an effective control, otherwise it wouldn't be there, but you do need to be mindful that it is seen and known as one of the least effective measures. And that's why when we come down to using these controls as a way of managing the risk, this is why enforcement, monitoring enforcement, is going to be very key as part of our return to work. So the risk assessment is only part of the story. It is going to be a very, very big part of your return to work, but it's only part of the story. And you already know from the examples I've given that lots and lots of actions will come out of the risk assessment. So it's very important, as well as creating your risk assessment, to create a supporting action plan. This is your deliverable from your risk assessment. So the action plan is going to be your working document. It's important to allocate responsibilities. It's important to put those complete by dates in. It's important to continually review your action plan so that you know you're on track. And if you've allocated a person to drive this for you in your organisation, that would be part of that person's responsibilities to check progress against the action plan. And people need to take ownership of their actions as well. If they're allocated an action, it's very important that there's a degree of ownership displayed there. It's not just a piece of paper that you're going to file away. This is your working document. This is the document that's going to drive your return to work and make sure that it's safe. Now, I did say that I did need to talk to you very quickly about monitoring enforcement, and I've related that a little bit to why that's important when you're using controls down the lower level of the risk assessment hierarchy. And I've explained the reasons for that. And we know that controls are in place for a reason. We know that the reason we're putting these systems in place is to protect the health and safety of the people that come into contact with you, with your work activities. But we need to know, to be absolutely sure that we have got a workplace that's safe, we need to know that these controls are being used and being followed. And we need to establish a system for how we would know that the controls are being used. So it's very important not just to think, right, we've got the control in place. As part of our return to work, we have got to check that those controls are being used regularly. And if they're not being used, we as an employer would have to take action to enforce the using of those controls, because it's so important that those controls are maintained. If the controls aren't there, or if the controls aren't being followed, and basically we're back to our high risk scenario. We're back to a situation where it's highly likely that someone is going to be severely harmed by that hazard, and we know we're talking about loss of life here if that happens. So as part of this programme, you need to think about how you're going to monitor. Are you going to have daily checks, for example, on stocks of hand gel? Are you going to have daily checks in the communal areas to check that people aren't congregating? You need to think about who's going to do it. Who in your organisation is going to be responsible for that monitoring? And you need to think about now what process you're going to have to put in place if you find that the controls are not being followed or used correctly. And obviously, if you've got a continual non-compliance with the rules, you may have to think about the strong measures of disciplinary, because people not following the controls, not following the rules, they are not only putting themselves at risk, but they are putting other people at risk. And obviously, that's not acceptable. So just before we conclude, I just need to talk to you very quickly about consultation. It is a requirement part of health and safety management anyway. Every employer is required to consult with employees about health and safety. It's particularly important as part of our return to work and our risk assessment based approach. It's now more relevant because there will be so much anxiety and concern, not by everyone, but a lot of people will be very, very worried about coming into work. We need to make sure that the risk assessment programme is an open process, that we're sharing the findings of the risk assessment with all the people who work for you. You need to make it public. You need to involve your employees in coming up with solutions as to ways that they feel might be a better way to control the risk. Ask people, the best way to control a risk is to ask people who are dealing with the risk, the hazard and the risk all the time, what would they feel they need to make it safe? Now, there will be times when an employee might ask for the impossible and it's not reasonably practical for you to implement that control, and you don't have to. If it's not a reasonable measure to take, you don't have to. But it's very important that you demonstrate that you've listened to your employees, you've taken on board what they've said, and you've explained to them what you are doing and what level of safety that's going to give them. That will really help to reduce the high levels of anxiety and hopefully make people a little bit less anxious about coming back to work. So your employees should be part of the solution. As I said, consultation is something that's required anyway, but it's even more important as part of our return to work and recovery. So I just wanted to make sure that I did have time for questions today. So I'm just going to leave you with a few slides just to conclude with the main points we've discussed today. So risk assessment and risk management is a crucial part of our return to work phase. The approach is very, very definitely health driven. The priority is to protect people's health as far as we reasonably can. So if you've not heard of risk assessment before today, you'll be sick of hearing the phrase risk assessment, I think, over the next few weeks. Remember, it's not just employees that you have a duty of care for, it's everyone on your premises and everyone affected by your work activities. So how are you going to manage visitors to your organisation, for example? How are you going to manage contractors once they're on the premises? So bear in mind that you do have to look beyond your immediate workforce when you're preparing your risk assessment. Risk levels will be different for different workplaces. So there could be a higher level of risk, for example, in an organisation, a catering organisation, for example, as there might be in an IT organisation. Degrees of risk will actually vary. You know, there won't be, I can't say to you, there's this level of risk for this hazard. You will have to make that assessment yourself. That's why it's called a risk assessment, because you're assessing the risks. And remember that individuals will be different as well. Some will be more vulnerable than others, and the degree of risk will vary when you're looking at those more vulnerable employees. And perhaps different and additional controls may be required to apply to that category of employee, which you might not necessarily implement company-wide. But it's very important to identify who those employees are and talk, consult, and ask them what they feel that you could do to make them feel safe when they're at work. It's really important to share your findings, to share your risk assessment with everyone. We have a duty to do that anyway. It's more important than ever to do that now to help manage the anxiety that people are going to be feeling coming back to work. Everyone has a right to know about the risks they're being exposed to, and more importantly, what you are doing as an employer to protect them. Statutory right to know that. And I've heard that there is an expectation from the Health and Safety Executive for those employers with 50 or more employees to display the risk assessment on their website. Personally, I believe that that is going to be part of their enforcement. They will start looking at employers with 50 or more employers, and the first port of call, I think, might be to look at their websites and look at the risk assessments that way. I've got a link on the presentation which takes you to a Health and Safety Executive notice, which just to finish off, it may be worth you downloading and displaying in your premises, which basically tells your employees that you have got a risk assessment in place, that you are managing risk and you are doing everything you can to make the workplace safe. It's basically a declaration, but it's a standard health and safety document that you can use, which can help to give people some reassurance. So I've literally covered risk assessment in a very, very short space of time. Normally I would spend anywhere between half a day and a day covering risk assessment, and I've tried to do what I've said we will do on the tin. I've tried to give you an overview and an introduction of the principles of risk assessment, so that at least it can start you off with your risk assessment programme and your return to work. But I'm very happy now to take questions. So Yaz, would you like to take us through the questions you've had? And I'll do my absolute best to answer them based on the information I have.
Okay, no problem. So I'll read them out for you. So the first question is from Paul, and his question is, should some of these actions be added into our terms and conditions for clients to be aware of their responsibility during a photo shoot?
Yes, that would be a very good idea. I think the more information at the moment that you can provide to people, the better. You know, it's all about sharing information. It's all about telling people what you're doing to keep people safe. The more information you can share. So yeah, good idea.
Okay, great, thank you. The next one is from Jodie, and it's, do we need to have a COVID-19 secure policy in place?
Again, very good idea to have a specific COVID-19 secure policy in place. At the Chamber, we actually put one in place prior to lockdown, before we even knew we were going into lockdown. I've got a bit of work to do on that now, but yes, with all your other HR processes, procedures, this is new. This is something that's going to take over our lives, part of our working lives, for a long, long time. So yeah, a policy, COVID-19 policy, very good idea.
Okay, next question is, what controls would you have for people who are disobeying the COVID-19 policy?
Wow. Yes, that comes back to your enforcement, doesn't it? I mean, if I just take a step back, if the controls aren't being followed, if the controls are being ignored, you're basically going back to a high risk situation. You've got a hazard which has been left uncontrolled, and you're back to the situation where you've got a high chance, a high likelihood of someone actually losing their life as a result of this hazard. So it's absolutely not acceptable to not have that control followed. So, I mean, I, with my HR hat on, I talk to the person first and find out their reasons for not following the control. Maybe they didn't know about it. Maybe they didn't know there was a process. But if there's a continual non-adherence to a control, that person is putting not only their lives at risk, but other people's lives at risk. And ultimately, it would warrant disciplinary action if the other soft approaches didn't work.
Okay, thank you. Next question is, what are your thoughts or suggestion on COVID-19 training for an employee returning to work, or any suggestions on this?
Yeah, again, very, very good idea. I mean, I've heard talk of when employees resume back to the workplace, and don't forget, you could be talking about furloughed employees here as well, but actually a mini induction might be a good idea for those people. We've been out of the workplace now for some time, we've been working at home, we've lost sight of company rules and procedures. A mini induction, obviously, which constitutes training, actually would be an excellent way to get everybody back on board. You could put something together yourself. There's lots of information out there about COVID-19. There's lots of information available from public health, from the health and safety executive, even if it's just, you know, continuing to raise awareness of the signs and the symptoms, of what to do if someone presents with symptoms of COVID-19, what to do if they're worried about being at work, about the threat and contracting COVID-19. Just take them through those processes as well. So training, that would be one of your admin controls actually. You know, I mentioned in the hierarchy of risk control where you have an admin control, training would be classed as a control measure under that category of risk control. It would be one of your admin controls.
Okay, thank you. And I think this is the last question, unless anyone has anything else. If an employee does not comply with the instructions of safety, what action can H&S team take and under law?
Quite a lot actually. I mean, health and safety does override everything. If you've tried every other option, you've tried the consultative approach, you've tried the enforcement through disciplinary, if there's a continual failure or reluctance or disobedience to comply with health and safety, that is gross misconduct. And ultimately we know that can lead to dismissal. So failure to comply with health and safety and failure to cooperate with an employer on health and safety, which is a legal duty that every person who works for you has. They may not know that. They cannot refuse to cooperate with you. That could be disciplinary. It could lead to dismissal under gross misconduct. But it would be worthwhile perhaps checking your contract of employment to see whether there's a clause in there which would help to execute that. But under health and safety law, yeah, the employer is able to do a lot.
Okay, great. We have just had another question. So should we also consider working at home as a risk, even if we consider this to be temporary, please? For example, display screen assessments.
Yes, I mean, that's a really good question actually, because I'm talking about return to work, but I suspect that some people may continue to work from home for a much longer period of time, because the rule at the moment is only return to work if you're unable to work from home. So yes, we're all thrown into lockdown, weren't we? And we got through that as best we can. And the health and safety exec at the time did actually say that they would actually be flexible in terms of enforcing their display screen equipment legislation, because of the fact it wasn't practicable for everyone, for every employer to go to everybody's house, for example, to conduct a risk assessment. So they actually said, because they saw this as a temporary solution, and we did not know how long it was going to go on for at that point. The guidance was, as long as an employer you're providing information about how to use DSE correctly, how to sit correctly, for example, that would suffice for that temporary period of time. Anyway, we've got this issue now, how temporary is temporary, and the temporary situation might go on for a lot longer. So yes, as an employer, you do need to actually consider the risks of working from home and perhaps do a little bit more to protect the people against those risks. And it probably won't come as any surprise to you that I'm going to say to you, how do you do that? You do it through a risk assessment. So maybe you send a risk assessment questionnaire to people who are working at home to ask them the questions to see what's coming up, you know, what they're experiencing health and safety wise as part of their working at home situation, and then you can address accordingly. But I can see that health and safety exec will start to get a lot stricter as time goes on in enforcing health and safety legislation, particularly DSE, for our home workers. So it's basically watch this space on that one.
Okay, I think that's it. If anyone has got any other questions, then do feel free to unmute yourself and ask them over the microphone if it's easier. I'll just give it 2 seconds just to make sure no one's typing. Okay, I think that's it then. So thank you ever so much for taking the time today, Dawn. I hope everyone found that useful to their business. If you have got any questions you'd like to ask Dawn over email or phone, I'll send her contact details with the follow-up email. Just from the Chamber then, we're running a couple more webinars in the next couple of weeks. So tomorrow we've got our lunchtime networking 12 till 1. Then Tuesday 12 till 1 as well, we've got how employers can support the mental well-being of their staff, and that's delivered by the NHS. And then Wednesday, we've got our sustainability forum from 10 till 11. And there's lots more going on. So if you'd like to sign up to our webinar e-shots, then please email the email address I'll just pop in the chat box now. But I hope everyone found that beneficial, and hopefully see you soon. Thank you everyone for joining. Take care.
Thank you.